So from my book, Surviving American Medicine, let me read a little bit from the introduction. The fact is, times have changed, and they're not changing back. In today's American healthcare landscape, you are now in charge of your own well-being. You are steering the boat, so to speak. And to do so efficiently and well, you need to know how to navigate the waters. That's what this book is designed to do, to help you make choices about your health care so you will feel confident that you're getting the best treatment possible. You'll learn what goes on behind the doors of hospitals and insurance companies, so you'll know how to get the best doctors, how to argue false charges on your bills, how to pick the best insurance coverage, and how to ensure that at the end of the day, you're in control. I give stories of my patients, and one of my patients said, whatever you do, I want my story to get out, and I want you to use my name. And so let me tell you about one of my patients, Preventing Illness, Chapter 9. Michael Landon was 54, at the top of his career, and excited about launching his new TV series. He'd also been experiencing severe abdominal pain for about a month, so he visited his primary doctor. He was told he had too much stomach acid. He was given some antacid medications and sent home. But on a ski trip with his family, the pain became unbearable. He flew home early, had blood tests and CT scans, and that night he was given a grim diagnosis: pancreatic cancer that had spread to his liver. After a biopsy confirming the pancreatic adenocarcinoma, Michael underwent 2 standard chemotherapy treatments and decided chemo was not for him. He attempted alternative treatments, but the tumor progressed. He felt he was failing. At that point, I saw Michael, started him on a new treatment program, an investigational therapy on a clinical trial, and I talk about clinical trials in the book. And he did well, appearing in television and continuing to work for some time. But then his illness began to progress. So let me continue with the point that is so important about Michael Landon. But Michael had not known about his family's dark history of colon and stomach cancers, diseases that had struck more than half his relatives. Hello, I'm Dr. Cary Presant, and I live in Leisure World and also up in another home that I have near Pasadena. I work as a hematologist, oncologist, and internist, and still practicing and also working part-time to try and promote my book, Surviving American Medicine, which I wrote based upon the stories and problems that my patients had. I'm also a professor of medicine at the University of Southern California, and I do research, practice, and do a lot of speaking. Well, you know, in the past, I've been used to writing articles on research, on new treatment programs that we've developed for cancer patients, on healthcare reform, many of the types of areas that a doctor spends their time doing. And these are largely publications for physicians or for patients. And then about 10 years ago, it became apparent people were talking to me about the problems they were having in accessing the healthcare system. Problems in finding out if they had the right doctor, problems in getting a problem taken care of, problems in where do I find care, it's just not working with my own doctor. And all the time, whether they were relatives or patients' families, or just friends at a cocktail party, I would wind up giving them information and thinking to myself, you know, there must be hundreds, maybe even thousands of people who have these very same questions. And I can't give this answer 1,000 times, maybe I should begin to put some of these recommendations, these tips, these suggestions down in a more logical format. And so I began to accumulate stories of my patients and the problems that they had had in getting the right health care. Sometimes getting wrong diagnoses, sometimes not being able to find insurance, sometimes having the right doctor and the right treatment, but it just wasn't working. And they were very frustrated. They were angry, frustrated, and wanted more advice. So in accumulating their stories, which I write in the book anonymously, we have answers and tips that can help so many more people. And it helps people to realize that the problems they're facing themselves are the very same problems that lots of other people have faced in the past. And that those problems can be solved with the right kinds of tips, recommendations, suggestions. And that's why I have those in the book. Now, writing this book was a challenge. You know, as a doctor, we learn how to do doctor speak. We have very long words, not very understandable words. And so I wrote the first draft of the book, gave it to my family, and I thought, this is terrific. And my family said, are you kidding? I can't read this. I can't understand that. So then we went back to draft 2 and 3 and 4, and we're now on draft 19 that actually became the book. And so going through all those drafts, you learn how to make certain that people can really understand what you're saying. People can get it, and people who have gotten the book really find a lot of value in one of the 30 chapters that we have in the book, and tips in every chapter, and parts of each chapter dealing with healthcare reform, and how healthcare reform may create new issues for people or help to solve issues. And we go into that, I go into that as I write this book, each of the chapters, to explain what's happening, what's coming, and what you need personally to do to prepare for that. You know, it's not a book that says, healthcare reform, this is what you have to tell your legislator. This is what you have to do here. It's really a book about what you have to do yourself with your own doctor, with your own insurance company, with your own family, to make absolutely certain that you're in control and that you can meet the responsibilities that you have today as a patient, so much more than the responsibilities you ever had before. Well, I've used my family and my patients. Even the cover of the book was voted on by my patients. And so we had a couple different covers, and the patients came in and they said, I like that one, or I like that one. And the cover that we have in the book now overwhelmingly was the recommendation of most of my patients and most of my family and my nurses. Oh my gosh, you can't believe the challenges that met, because the original cover that I had designed was uniformly rejected by everyone. And so it shows you that if you're a doctor, you may think you know some things, but you really got to be very careful, because you don't know everything, and you don't clearly have a good idea of what's going to help people the most. You know, I've tried to figure out exactly who's this book best for. And so it varies a lot. Certainly, we have a lot of elderly people who are being faced with a lot of challenges, diseases, conditions, problems, new aspects of Medicare and Medicare Advantage plans and secondary insurances. And they have problems in terms of which insurance should I get? And they have problems in terms of how do I approach this condition? And then we have younger people, and their problems are, number one, how do I avoid getting these illnesses that I see run in my family? Do I have a tendency to get these illnesses? How am I going to prevent these? And so we have a chapter on prevention, a chapter on assessing risk, what diseases may you get, and a chapter on talking to your physician. How do you focus in on prevention? I even have in there a mini test to determine how good your preventive medicine is. So people who are a little bit less than elderly have to know about that, but they also have another challenge as well. How do they take care of their kids and set them on the right track for their health care? How do they take care of elderly, their parents who are aging? How do they help out with them? And then when they get illnesses, how do you take care of people who are ill? What do you do to help out there? So I have chapters on those three aspects. How do you start kids out? How do you take care of kids? How do you take care of the elderly? How do you take care of people who are infirmed or ill? So that you can be a good person to help them out. And then for people just starting out, just graduating from college or just starting out life, the question is, how do you get the right health insurance? How do you find the right doctor for you? And we have a series of steps, 12 steps in terms of finding the right doctor. How do you know if you found a doctor that's the right doctor for you? Because, you know, some doctor may be able to relate very well to Mrs. Jones out there, but Mrs. Smith may require a doctor who approaches a little differently. So how do you make certain the doctor's the right doctor for you? And so we have a mini test in the book. It's a mini test, takes about 5 minutes, and you can go through and see if the doctor's doing the right things with you. And you can rate the doctor, very easy to do that. Doctor's reputation, the doctor's office, the doctor's staff, how the doctor actually interrelates with you, and does the doctor take care of not only problems that you have, sore throat, urinary infection, but take care of prevention. Prevent you from having heart disease, prevent you from getting cancer, screen you to make certain if something's starting to happen, they pick it up at the very earliest moment when the doctor can take care of it and avoid bad consequences. The book deals with the problems that I see in patients every day. It deals with a lot of the data that we've seen in terms of how common some of these problems are, like obesity and high blood pressure, cancer becoming more prevalent around the communities, but with a higher cure rate too. More ability of science to prevent disease than ever before. And the question then is, how do we as patients access the doctor that can deliver that new science to us? How do we make certain the doctor doesn't just see us for 5 minutes, which is very common nowadays, and you're in, no sore throat, out you go, you're doing great? Well, that's very superficial, but that's common in medicine today. So the tips in the book deal with how do you get the attention of your doctor? How do you maintain that attention? How do you get your questions answered? Questions about prevention, questions about what's my risk of these serious diseases like heart disease and stroke and diabetes and obesity and metabolic bone disease like osteoporosis and arthritis. Cancer, one of the biggest fears that people have. What's your risk of cancer? How can you reduce that risk, both with lifestyle and medication, everything? So I go into that in the book, and I don't give all the answers, because the answers for Mr. Jones may be the different answers from Mr. Smith. There are different risks of different diseases. But I do tell both Mr. Jones and Mr. Smith the questions that they have to ask their physician, the questions they should expect answers to. I give them examples of the answers they should expect. And I also, within the book, give everyone trusted internet sites so that when you go in and ask about whether it's heart disease or it's cancer or it's lung disease, that you have some background of information, both general and very specific information about different diseases that may run in your family. So you can go empowered with information from very trusted internet sites. You know, when we read in the paper, gosh, there are thousands of internet sites. Well, you know, when you go to the internet, you're faced with a challenge, because whatever search engine you use, Google, Yahoo, Bing, you put in something like cancer, you get about 2 million sites. You put something like heart disease, you get 3 million sites. So how do you know which sites are right? You don't want to spend the next 4 years trying to figure out information. You want to go to the 1 or 2 or 3 sites that you can really trust. So I spent a lot of time in the book researching different internet sites that I want my patients to go to. And those are the internet sites I suggest in the book for everyone to use. So there are general sites about medicine, about symptoms, about aging, and there are specific sites which deal with heart disease and diabetes and lung disease, cancer. And therefore everyone can find information, both for yourself and also for your parents, also for your kids. And so this is a book that can be shared in terms of its being a resource. Each of us has a network of social contacts that we have, whether it be just through the community, PTA, church, some organization that we belong to. And this networking provides us with a lot of information and a lot of input that we can have to understand how our own care is going and how the people are perceived who are giving us that care. And it enables you to be more in control of your own health care. And you can be sure that the doctor doesn't have time to be the old Dr. Welby from television from years gone by, who knew everything about all their patients. Today, you need to be that glue that brings the doctor together with you. So here's some tips about your next appointment when you go to see the doctor. Number one, you want to make certain the doctor pays attention to the things that are important to you. And I give a whole list of questions in the book that you can actually write down. You can even take the book with you and ask the specific questions with the exact language that will get you a good answer. Write down those questions. Bring that sheet with you. Keep it on your desk at home. When a new question pops up, when you're reading the newspaper, or you've just been out with friends, and something came up as an idea that I want to really explore that with my doctor, write it down. And then when you go to see the doctor, bring that list with you. Bring a pencil, because you want to write down the answers to each of those questions. I can't tell you how often patients go home and they come back the next time and they're asking the same questions again. I gave them the answers the first time, but you know, it's the scariest time when you go see a doctor. And because it's scary, you're not going to remember everything the doctor says, so write down the answers. And bring a buddy along. It could be a family member, could be a friend, could be a, quote, healthcare advocate, but bring someone with you. You know, 2 people sitting in front of the doctor get a lot more attention and time than 1 person does. Also, that other person can help to understand what the doctor means when they say things. If you're not sure if you get it or not, if you understand what the doctor said, the other person can pipe in and say, could you explain that just a little bit more, because I didn't quite get that and I don't think the patient quite got that either. And that's really helpful, because the doctor takes more time to explain. And make certain you understand what the doctor's saying. You know, I have some of my own doctors who speak with a bit of an accent. You might have them too. And if you do, you got to make certain you can fight through that accent and understand everything that they say. And heaven knows, we doctors use completely non-understandable language sometimes. You need a gobbledygook test. You have no idea what that is. So you have to get them to explain gobbledygook to you. So that helps tremendously as well. The other thing that sometimes helps is to use one of these things. You know, these are smartphones. Most people have them. If you don't, you can buy a very inexpensive recorder at any radio shop. And these can be used as a recording device. So what you can do is just click it on to record and ask the doctor, do you mind if I record what you're recommending to me for my diet or for my medication, so I really understand what it is? I can listen to it at home and I can remember it much better that way. 95% of doctors will say, no problem, switch it on. Then there's the 5% who say to themselves, oh my goodness, they're going to sue me. Well, that doesn't happen very often, but it does sometimes happen. If your doctor's so worried about being sued because you're going to record something that's important to you for your life, you may need to get a second opinion, See my 10 commandments for second opinions, and you'll know that's one of the things you have to make certain you're able to get all the information from your doctor. That communication link is very, very important. And we've done a little study on my patients. Those who use recordings, they typically listen to it between 1 and 2 times at home, but their family also listens to it 1.5 to 2 times as well. So now you got your health team in sync. You know, it's really important nowadays to have your health team together, more so than ever before. So what's your team? Kobe Bryant doesn't win by himself. Nobody in any sport wins by themselves. We know that. But more importantly, with your health care, you're not going to get all the care you need by yourself ever. So you've got yourself and your family working together to make certain you get the right care. You've got your physician. And I talk in the book about how do you choose the physician, how do you rate the physician. But you've got to have a good physician. It might be physicians, many doctors who have different specialties helping you. Your eye doctor, your heart doctor, your diabetes doctor, your bone specialist. All these kinds of diseases that are so common today. You might need a couple different specialists. So you need your doctor or doctors and their staff. They have to be there to help you as well. You need to have a hospital, one that's on your health plan. So you need to make certain you're going to the right hospital. And you can ask that doctor and the staff, you know, if you were sick, which hospital would you use? Would you use the local one here? Would you go to a big university hospital? Would you go to a big tertiary care hospital that sees patients usually only on referrals? And you can think about, would I be more comfortable at a smaller hospital, a little more attention? Would I be happier at a bigger hospital, more patients, maybe more experience, but also harder to get some of the care? So you can talk to the doctor and the doctor's staff about those things. Then your health insurance. You've got to make certain you have health insurance today. A person going without health insurance is taking his life in his hands. Because if you don't have good health insurance, you may not get good care. And the leading cause of bankruptcy in the United States today is medical bills that you can't pay for because you don't have health insurance. So if you're younger and you say, I'm going to wing it, I'm not going to have health insurance. If you've got kids who are saying, oh, I'm healthy, what do I need health insurance for? One car accident, they could lose their houses, they could lose all their savings, they could lose everything that they worked so hard to get in their lives and can change their lives forever. So make certain you have good health insurance. So part of that health insurance member of your team is not just the insurance, could be an insurance broker, because health insurance brokers are free. They'll tell you the differences between different health plans. I do explain them in the book, but on the other hand, we also know that because these change very rapidly and because there are little nuances between different plans, and even nuances between the health plans being offered by these healthcare exchanges that are popping up in California, every state, and the federal government, these health exchanges will change the type of insurance available to you. And a health insurance broker agent can help you. And in the book, I give the website where you can find a health insurance agent who can provide you with a lot more information for free. Just remember, you don't have to just go to one, you can go to a few different ones, compare plans, and see what's doing. So there are 4. So who's in that pinky finger? Who's the other member of your team? That's your pharmacist. Remember that we all take many different kinds of medications. Which ones work well together? Which ones can you get a generic for, and which ones do you have to buy brand name? Which ones can be replaced? What are the side effects? What do we have to watch out for? You need to have a pharmacist who can help you. Online pharmacies can provide you sometimes with less expensive medications. Having a pharmacist that you can actually talk to and go over all your medications, go over all your over-the-counter medications, this person can be one of the most important components of your healthcare team. One of the things I go into in the book a little bit is finding affordable medicine, and part of that is finding affordable medications. We know medicines have become so expensive nowadays. I mean, I give out medicines in my oncology practice that can cost $10,000 a month. And it's an oral pill. Well, I mean, how can people afford that? Well, the answer is, number one, you have to have insurance that covers that, but number two, you have to be able to talk with your doctor about getting more affordable medications. Medications that might be generic instead of brand name. Is there a generic available? Is there a generic that works about the same as the brand name drug? Might not be identical, but you can start with that. If you really need a brand name drug, the question is, can you get samples? If you need a brand name drug, can you get a double-sized pill, cut it in half? Pill cutters are cheap, and oftentimes those brand name drugs can be split in half, and you can cut your medication costs in half. Your doctor can give you that question, can answer that question for you. Your pharmacist can answer that question for you. And then lastly, if you really need brand name drugs and you just can't afford them, you can't even afford the copay even if your insurance will pay for part of it. Every pharmaceutical company now has programs for their expensive medications. These programs for people who have commercial insurance, that is under 65, might be HMO, it might be PPO, it's some type of insurance, could be through one of the exchanges. They have programs where if a person is on a limited budget, and sometimes these limited budgets can be up to $100,000 a year, so it doesn't mean you have to be destitute. But if you have a limited income, they can provide you with low-cost drugs or free drugs of their brand name drugs. And they have that commitment to people to provide those. If you're on Medicare, companies have invested in foundations. These foundations then can give patients who are in need of support a grant of money to help them with the copay that they have to pay for when they get the medication. So expensive medications can become free or cheap for you using tips that I give in the book and information that you can get not only from the book but from your doctor and your pharmacist. So these types of pieces of information can really help a person to live better, live longer, be more confident in their care, and save a lot of money in the process as well.